Okay, kids, does everyone have a packet for today from the front of the room? How many questions are on that first half page? 8? Is that 8? Okay, I'll give you 8 minutes. Michael, I texted her. She has not yet responded, but just give her time. Seems important to.
What the freaking heck is that? Why the top of your computer is
AP test? I know, I'm expecting.
All right, let's look at that front page.
I'm just waiting for the super redeemer line.
Miss Taylor, do you get like results back for all your students?
No, I get like Ryan gets a whatever
5.
grade.
Yeah.
And then I get down like a breakdown of like what percentages. But I don't see Ryan's test grade. I don't see Ryan's test. I don't know. But I do get like, of your students, this many people did this well in Unit 1. This is the breakdown for Unit 2, Unit 3, but I don't see your individual.
Really?
I get your FRQs back, but not until like next March.
Yeah.
So by the time I get it back, it's like,
Who cares?
Maybe we don't want to see that.
well, I don't even look at them because it's not even, your initials are on it, and I don't remember like who's ours.
Wait, just our initials.
Yeah. So I have to like figure out whose it is.
I mean, like handwriting.
All right, well, I'll give it to you anyway, so you can at least start looking at it. Because you were by yourself today. She was. Y'all were both here Friday? You weren't here Friday, so she was here Friday. And you were here today. So y'all haven't been together at all. Okay.
So
Wake up. No, not for you.
Wake up. We'll go to your question.
Wake up.
Yeah.
Wake
up. Okay.
Okay.
Oh, that's.
What's psychoanalysis?
Unconscious.
I know.
Yeah. Oh, that's the.
You read this unconscious.
Or trying to never have it.
Oh, delusional.
Yes. What's C for this? OCD is an anxiety disorder. Oh, conversion.
Pass that around.
Stop, why are you so worried? Wait, why do you have to do your ID?
They have to cross-reference to make sure that you're actually a student in the course, so that I'm not making
Who's they?
people up. Central office.
Did you like actually check this?
I have no idea.
That's so crazy.
She's been meaning to show us all that.
Like you? Were you on a hashtag? So what? So what?
Someone did it for me. Was it me?
Bro. So, okay.
Why are these so big?
You don't have to be smart. You just have to know how to respond.
Oh, I'm sorry.
No, I'm really it's not.
You like that word?
Yeah.
I'm trying to.
Oh, yeah.
Jessica notes the 11. That's junior year, yeah, it makes sense.
Couple more minutes left on the front.
Do you still get like followers?
Hey, Brian, people are around you are trying to do stuff.
Jessica, did you print the thing for a while?
Was that the thing in the?
Yeah, that's the box. I was gonna say
Condition in which a person's
Because of me. Are you sure? I forgot what it's affected. I always remember how
I think it's
disassociative.
Paranoid,
But that's
dissociative,
another
and catatonic. Yeah, that's a dissociative disorder. So
Wait,
it's a
it's not like this.
dissociative identity disorder. You will see.
Scary.
That's weird.
Or like lose their vision.
Wait, what?
Wait, that's like.
Not
Say home
normal.
color.
Oh my, that's not what it was.
Pencil. The primary. Wait, Miss
Give
Taylor.
me
What's the
pen.
primary
What?
prevention?
That's
Like before you even talking about right.
Like,
Oh, Stella.
what do you
happened to
think it
Stella?
means? Like prevention.
Stella doesn't
First
all of a sudden
prevention.
just-
Before the thing.
Like I'm going to prevent something from happening in the first place.
Oh, okay.
I said prevention.
So my point, she can't come today.
Eating disorder.
But y'all are going to quickly look at your stuff
Oh, it's like.
at the very beginning class tomorrow. So not the
I
whole
know,
class,
random
just
person.
maybe
I know.
go through things that you're like, I was unsure about this one. So circle the questions that you want to go over.
Wait, so we're having a party? We didn't plan a party.
Oh.
The third. We didn't plan who's gonna
I
bring
think,
them.
oh yeah, I'm gonna learn
Yeah.
to know.
I know, that's what I'm saying. We
Can
can
we go to pizza and can you pick it up?
What? Why would she be able to pick what?
Why am I?
That is the goofiest,
It is. She picked it up from the last year.
goofiest thing I've ever
Mercer
heard.
picked up.
Just bring pizza.
Yeah, no. I have in the past. I actually was talking about that because Miss Fleece and I used to order food for kids. It became such an unpleasant experience that we're like, we're never going to do this again.
Wait, why was it unpleasant?
We ended up losing money. Kids would say that they paid and they hadn't. And they're like,
Oh,
well,
they like Venmo you?
There you go.
yeah,
Oh.
And then it's
yeah,
like
I remember
cash
that.
only.
right. And then I had kids steal pizza that wasn't theirs. And then the last year I did it, not a single thank you from anyone. And I was all like, well, screw you guys. So, and even Miss Fleece buys like Panera bagels for everyone. And then she's all like, I didn't get a single thank you. Not a single person said anything. And she's like, that's the last time I'm doing it. I was like,
She did give us
Uh,
donuts.
Increase that kids would pay you back.
That's crazy. That's actually good. One time, someone in my WAC class, someone
Okay.
just brought donuts like randomly for our whole class.
okay.
Could that be like the? No, I'm scared of questions.
Wait, Jessica. you-
Okay, so are we ready to go over the first page?
Yes.
Okay. According to the psychoanalytic theory, basically that's where you can kind of stop reading. According to the psychoanalytic theory, because it doesn't matter whether the answer choices make sense, it is using terms from the psychoanalytic theory. Okay. What is the correct answer here?
See, yeah.
It is C. What tells you that it's C?
Unconscious.
Unconscious. Okay. What is E? What theory is that? What perspective is E?
Free.
Moral weakness, lack of willpower. You could say trait. You can also say humanistic. You're not being the truest version of yourself. You're like, there's a fault here. So could be trait, could be humanistic. What about physiological events that cause chemical imbalances? What perspective is that?
Biology.
Biological. Social, economic, and culture factors. B. What?
What do you say?
Social cultural. I mean, it's like in the word. Social cultural. And maladaptive learned patterns of behavior. Behavioral. So most of the perspectives are there, not all of them. Most of the perspectives are there, but so it's not like completely making stuff up. All right, on number 2, it says when community psychologists refer to the primary prevention, what are they describing? Okay, so if you had to guess, which you probably did, which one of these do you think is all about the prevention? Not C. It's just A. Yeah, keeping disorders from developing, like preventing the disorders from even being there. It does make sense. I can see why you would put C, reducing the harm of psychological disorders, but this is like the disorders are already there, let's contain them. So that's more like about containment versus the preventing of it, if that makes any sense. Okay, going down here, which of the following individuals would most likely be classified as exhibiting a social phobia? So there's some sort of like social aspect, some sort of like group phobia here. Which one? Pretty. She's afraid of being humiliated when giving a speech. That's in front of others. All of the other ones are specific phobias. So there are social phobias and specific phobias. So it's like, I'm afraid of spiders. That's going to be a specific phobia. But if it's like, I have a social aspect to it, then obviously that's going to be classified under social phobias. All right. Delusional thinking. Okay, first off, let's go down the path here. What's a fugue state? What's fugue mean? You go somewhere. It's travel. Traveling. You up and leave. If you have some sort of fugue state, you're on the move. Michael, if you need to go in the hall because we're being loud. Oh, you have your headphones on? No, you don't. Okay. So you can go in the hall if you need to. Delusional thinking. Panic attack is going to be under what branch of disorders? Anxiety. What's delusional thinking all about? Schizophrenia. So we have delusions and hallucinations. I smell burning bacon. What is that? That's a that's hallucination. I smell. There's a false sense experience. Aliens listen to my phone calls. Delusion. Okay, that's a false belief.
It's like someone saying like, if someone like loses like sense of time, is that also a hallucination?
Define sense of time.
Like, I can't think of like an example, but like if someone's like when you're drunk, you can't like just like really like tell time, but I mean it's not like a hallucination.
No, it's not.
But like some people define like hallucination as like anything that's not like a distortion.
No, a hallucination is a false sensory experience. You're having a sensation like touch, taste, sight, smell, whatever sound that is not real.
Okay.
So it has to be senses.
Sensory.
It has to be senses. Okay. Yes. Oh, what's a dissociative disorder?
Like well, it's
Not a
just
percent disorder.
Identity.
Right. So what is that? It's like a, but it's like a break of consciousness.
Okay.
What's an example?
Ooh, I can't spell conscious. It's conscience. Conscious. Mess. This is going to be someone who has split personality, like DID. They have split consciousness.
You said yes, I thought you said no.
I said the whole time. No, it was because I said personality. And
I'm
it's a whole different type of
racing.
disorder.
This. Okay. All right,
You said what's
scrolling.
affective
Here we go. All right, all the following are anxiety disorders except, what's agoraphobia? I mean, it's a phobia. Fear of like open spaces or public spaces. Fear of like public, open, like a big field or like a shopping mall or something. They're not gonna like that. It's like the opposite of claustrophobia. PTSD, anxiety. Yes. This is what brings it about usually. Trauma. You often see this a lot with people that have had military service. Okay, between the three that are left, conversion, obsessive compulsive, and panic, which is not the anxiety disorder. Okay, what is conversion? Okay, that's what the word conversion means. Conversion disorder. There's a physiological thing that's happening here. So there's something for no physical reason. Like you go blind, yet your eyes are fine. Some physical manifestation of your psychological problems.
What's the inverse?
What's the inverse?
Like
the opposite of conversion?
yeah, like I don't know, like when you
Not having a physical.
or like somatic or something.
Oh, those are the synonyms.
Yeah.
So somatic, yeah.
It's like where you hurt but you don't know why.
Yeah. But those are going to be very similar to each other. Okay. Obsessive compulsives. By the way, these are two different terms. Those are two different, like, there's hallucinations and delusions that are always tested against each other. Like, one's a belief, one's a sensation. But obsession and compulsion are also, those are like same disorder, but a compulsion is a behavior. I have to wash my hands 10 times. Obsession is going to be some sort of like, I don't want to use the word obsession, but it's like a thought. Your thoughts are like on repeat, and your behaviors also as well. Okay, we know what a panic disorder is. Research on electroconvulsive therapy has shown that it's most effective for treating. We talked about this in class today. Which one? C, major depressive disorder. Okay. How would you treat? How do you treat different anxieties besides medicine?
Exposure therapy.
Okay, so we have exposure therapy for what?
Phobias.
Phobias and probably PTSD. They're gonna like
Flood.
surround. They're gonna
Jesus.
flood them.
Gunshot.
Yeah, gunshots. But like, I'm gonna take you to a fireworks show. Okay, so it doesn't have to be gunshots. Exposure. You're back at war. Oh God. Exposure therapy.
People are gonna get PTSD from the school shooting.
Okay. Okay. So yes, exposure therapy, where it's flooding, maybe. What if they do it really slowly?
Exposure.
Oh, wait,
Oh my
what?
God.
Trickle.
Systematic.
What was it called?
Systematic
Trickle or
desensitization.
what?
Okay.
Sorry.
All right. All right. A client whose improvement during therapy is as a result of his or her expectations of improvement. I'm feeling better because I expected to feel better. Is what? Yes. Does anyone remember?
The negative
transfer.
energy.
Oh, the negative.
What's it called?
Oh, you're like transferring. I don't know.
I'm absorbing all of her negative energy, and I'm gonna therapeutic touch. Therapeutic touch. Hey, let's talk about transference. Okay. Transference is when this is a psychoanalytic term, so this is very much like Freud. And so this would be like where you are transferring the feelings that you're going through in therapy. You transfer those feelings onto the therapist. So let's say you're talking about your mom, and you and your mom don't get along. Well, you're gonna start feeling those feelings of anger, not towards your mom, who you're really angry at, but toward your therapist. And so this is you transfer feelings, transfer to therapist. Yeah, basically. Okay, y'all probably don't know this show because it's way old, but it's one of the best shows that I've ever asked any adult. It's also makes all the lists. Sopranos, HBO. Yeah, it's like mafia show. Okay, so it's really good. Anyway, the main character, Tony Soprano, he goes to therapy because he kills people for a living and he has panic attacks and he has sexual feelings for his therapist and is constantly trying to come on to her. And she's like, well, this is because I am a strong woman and I remind you a lot of your mother. And you are transferring your sexual feelings from your mother onto me.
Yeah.
And he basically was like, if you ever say it again, I'll kill you. And she's all like, I believe you. But great TV show. If you ever want to watch it, Sopranos. It's on HBO. All right, what? It's very it's very 1990s therapy. So the therapy that was done in the 90s is very from of that time. All right, light exposure therapy. Most effective in treating what? Sad. Okay. I have not. I'm gonna pass back it tomorrow. Just in time. I have your old FRQs that you talked about, SAD. If you did, those of you that was on the pink page, a lot of you got this point right, but a handful of you said it's depression that happens in the winter months when it's cold. It has nothing to do with temperature, and it has everything to do with sunlight. And so that's why it's not called heat blanket therapy. It's called light exposure therapy. So it's about light and not about temperature.
I was gonna put they were in green. I don't remember.
All right.
I think I had that. I think I have that.
This next page, 1, 2, 3, 4, 5, 6. I'm gonna give you 6 minutes. Go.
Alright,
I looked over just to make sure. Circled a couple questions.
Okay.
wrong.
Okay. So beginning of second. So you're not gonna be able to go over. I'm sure you'll be fine because both you and Melissa do really well. But you'll
Oh no, there was one.
I just want to go over this because I don't want to change your answers for her. So.
right, and that's why I want her to be here. But yeah, we'll go over that. Then y'all can come to an agreement, and figure out what's going to be.
All right, thank you.
You're welcome. Where's that sign-in sheet? Is it hanging? Oh, there it is in the front. Oh my gosh, thank you. Okay,
Thanks.
Why is Christina's name on here?
She's gonna be here, trust me, I hope, maybe. She's,
All right.
her stuff's right there, so.
So
She better come.
Stuff.
Okay, her stuff's somewhere in here. I hope. I took it, I don't know what happened to it, I'm not gonna lie.
Okay.
Still looking.
D.
For which one?
I'll be right back.
Even though it's
Yeah. Or do you-
Chris is gonna kill him.
Zora?
An individual has recurring unwanted thoughts between harm to his family.
Me too.
You're gonna.
I'm kidding.
That's on video.
I wanna harm your family too.
Okay.
You are not going to like the answer. That is
Yeah,
correct.
I don't know. 'Cause
Yeah.
I put seeds and I was like, there's no way it's seed.
I think
So I changed it to A, but I still think it's wrong.
I don't think.
I
We'll
don't
go over it in a
Recurring
couple
unwanted
minutes.
thoughts.
Yeah.
Isn't that like
And it's
obsessing over it.
unwanted though, so it's like,
Oh.
isn't it like?
It's unwanted.
Where was it?
It was in my teacher's class.
Which one?
What do you mean, which one?
It wasn't in this.
Somatoform. I don't know what that is.
Wait, what do you think it is? You think it's OCD?
Somatoform.
I would've gotten it.
Yeah, I know.
But
What is it?
I'm so
the
glad.
date is also recurring.
I would've got murdered.
Wait, but doesn't it apply to both? It's like Jeffrey
Yeah.
Dahmer was like, I have these thoughts and I can't.
Compulsive thoughts.
He had antisocial disorder.
But okay, so antisocial
I mean, this
personality
is a-
disorder is not there.
Yeah, that's why.
Yes,
That's why.
Can I put
Is this-
F? Psychopath?
No.
Psycho.
I don't know what so much intelligence.
I put A.
Okay, that's what I meant to say instead of somatic, because somatic is type of memory.
Mhm.
So conversion and somatoform are the same. So I said somatic earlier. That was a misspeak. It was somatoform. I just started with an S and have no.
So somatoform disorder is
It's conversion.
conversion disorder.
Yes.
Okay.
Synonym.
Synonym.
I love the peanuts synonym.
He said reading. Hey, cheating.
Are we supposed to discuss this?
George.
George. Because I feel like
Like,
he could be like a. I feel like he could fit.
oh, E.
But that doesn't.
No, because it's like the
Like,
troubled
yeah, he's
childhood,
like
right?
giant,
That's
like,
the one with the
it
troubled
seems
childhood.
like
You
like,
have.
I think George is E.
Is this the
No, I
Isn't
don't
that
think
like-
George is
oh.
E. That seems too like.
Where did
I can
that
maybe
fit?
see him like.
No,
when
I
he's
just
young,
don't know.
like him running an investment company. He's being rebellious.
It's
I don't think
ED.
it's. I think he's
BPD.
more of like a
Oh,
sociopathic.
No, I
I don't know, I could have sworn like
You're
he
like-
was like, he
you're
had like a
everywhere,
troubled
yeah.
childhood, that was like a whole
I think
thing.
he's a
No,
narcissist.
you just
No,
happen
so-
to be.
We didn't
No,
talk
so,
about
like,
E.
No,
So,
I
like,
watched
Opposite
this.
OCD, oppositional defiant disorder.
Yeah.
But there's like a good
Oh, wait.
8% of the school right now that's OCD.
Oh, yeah, true, you are.
Where they refuse to listen to teachers because they are a teacher.
Uh,
Because like any authority figure of any kind, they will not listen to them.
So that's the answer.
No,
No, this is not.
that's
It's
the
not
answer.
ODD.
Yeah, no, yeah. I missed it. It was.
So like if you tell them like you need to
It's
sit
not
down and be
ODD?
quiet
They'll stand up.
because they yes they will stand up. You can't tell me what to do.
What would be post-traumatic
It's not like I just think that Charlie's a good beating. But that's just me.
Wait, when you said it's not ODD?
Child is George is not ODD. No.
What is she then?
What's
George seems like
ODD?
a raging narcissist.
What is
He's
ODD?
above the
Look at the
law.
look at E.
Yeah,
We're
I think
above.
so.
Because he
Oh.
defined the law.
I don't even know anymore.
I think
But
I'm.
this
Well,
honest-
I'm
he's doing
in-
illegal
I'm
things,
in-
and if you do illegal
It's not
things,
borderline.
kidding, I think
I
I'm
feel like
it's
publishers probably think you're above the law.
What's dissociative?
I got it
process?
wrong.
If you're thinking,
Okay.
oh,
I think
What's
I'm
Tyler
dissociative?
this.
Yes.
You just asked her that.
I completely.
A break in like consciousness.
Miss Sadie Stamps.
Do I have stamps?
Snacks.
Oh, yeah.
Oh, unfortunately no.
I'm gonna pass out.
I don't know if that's empathy.
You can lick the adhesive off the stickers.
Like,
Okay.
This is all benefiting him. It doesn't.
Can we go over?
Help?
No.
Yeah.
Well, like one more.
Wait.
Yeah, go ahead.
No, go over it.
Go ahead.
Okay, Dora.
Finish.
Let's talk about Dora first. Dora alternates between periods of extreme euphoria when she is very talkative, overconfident, hyperactive, and times of profound sadness, where she experiences feelings of hopelessness. What does she got?
Bipolar.
Bipolar disorder. What's the treatment for bipolar disorder?
Valley.
Not Valium.
I always forget.
Lithium.
Lithium. Okay.
Oh yeah.
Lithium, bipolar, Valium.
Oh my gosh. Okay.
It's not schizophrenia. No, yes.
Wait, no.
I think maybe.
Oh, what's the treatment for schizophrenia?
Valium.
Schizophrenia.
GABA.
Schizophrenia is the treatment for schizophrenia.
It's
What is the treatment?
It's
Oh, the Prozac. Oh wait.
No,
Thorazine.
Yamor.
Okay.
Is it-
And
is it-
anything with Zine or
Oh,
Zine.
yeah.
Okay, so chlorpromazine, Thorazine.
So
It's an antipsychotic.
What's, okay, so Ian is anti-psychotic. What is Ian?
Oh, anything that like ends with E, like zine. So chlorpromazine, or thorozine. The last bit of the word, if it looks like zine or een, then it's going to be a antipsychotic.
What's the one for the depressing ones?
We'll get to that soon. We will get to that soon. Okay, so I scrolled too much. Oh well, let's do this one. All right. Keyword here: recurring.
Oh.
Individual has recurring unwanted thoughts of doing harm to his family. This is consistent with. Okay, what can we say it's not?
Hey.
Why not A?
It doesn't like explain narcissistic stuff.
Okay, narcissistic is a personality disorder. DID is a dissociative disorder. Don't confuse the two.
Oh wait, did I?
We're on
Wait, which one are we on?
And
This one.
Oh, I thought we were on the
It's
one
not
below.
A
I thought we were on
because-
below it. No,
It's not A.
Because it acknowledges he's
My bad.
having the thoughts himself.
Like he's having the thoughts himself. He's not. It's not his like alter ego having the thoughts.
Sorry. I thought we were on the question.
It's not. What else?
D.
It's not D. There's no physical effect of what he's. It's not like his hands are going numb every time. It's not. Gosh, half of you are this right here. Attention deficit hyperactive disorder. No. That kid just has a hard time sitting and still in class, but doesn't necessarily want to harm their family. Okay, it's the correct answer.
Oh my gosh, that doesn't.
Okay, and here's why. He is obsessed.
Killing them.
He's obsessed with it. He has this obsession. That's all I can think about is these reoccurring feelings and thoughts. I know you're probably thinking of, well, like, is he like wash his hands a whole bunch, or is he like a hoarder, or does he like have a checklist that he has to do 5 times before he leaves his house? No, but he has these obsessions that he can't avoid.
Jesus.
You know what's on there?
Okay. All right, the role of the therapist in cognitive therapy. Cognitive. What am I looking for here? Thinking. Okay. So, what's C? Interpreting dreams.
Psycho.
That's psychoanalyst. Okay, so psycho. I'll say psychoanalytic therapy. Oh my gosh. What about effective functioning and client and positive changes?
Self-centered.
Humanistic.
Yeah, I was trying to figure out what word to use.
Psychoactive drugs.
That's
Biological. Okay, so we either have providing unconditional positive regards, so the healthy growth.
Isn't that also?
That's also humanistic, which means, hey, wants to focus on our thoughts and our beliefs and maybe have a different way of thinking. I mean, they almost say the word thinking like 15 times in that one answer choice. All right, let's talk about Betty. Poor Betty.
Oh, no.
Happens to the rest of us, Betty.
I know. Betty's all like, what?
Betty's like, what?
No.
I got fired?
I would have remembered.
At work. I'm working.
Gaslighting.
Oh my
There's a
God.
lot of things.
The ultimate
Exactly.
gaslighting.
Depends on country.
Wait, what do you
No.
mean?
No, like they probably don't believe me.
No.
Okay, so Betty lost her job and she kept returning to work each morning because she did not remember that she had been fired. She saw a doctor who found no brain injury or other neurological conditions. I'm gonna stab you. And so what's going on?
She's got this.
She's got dissociative amnesia. There's some sort of break in consciousness and she's not remembering it. If she were to leave all up and go, then there'd be fugue involved. Bipolar disorder is not, there's no mood thing happening. Schizophrenia, there's no hallucinations or delusions here. Antisocial personality disorder, that's going to be your psychopath. She's not like, lacking empathy or anything like that. But you know who is lacking empathy? George.
Okay, this is why I said narcissistic, because I was on the wrong question.
It's still not narcissistic.
No, I know. That's why. Yeah,
Okay.
It's not. Yeah.
It's antisocial because he keeps doing things, repeated acts of vandalism, meaning he's not showing any remorse. He's not being empathetic. He is, he's breaking the law. Doesn't really seem to care. Narcissistic is more like self-centered.
Isn't that self-centered behavior?
Yes. That's what she.
No, but it's not narcissism.
No, I know. Like, I got the right answer. I was just saying that's what he just said. Like, he's saying is it self-centered, narcissistic?
No, I said isn't he being
Oh,
Yeah, that's
no,
what
I
he's
think
saying.
you said it's what is it called? Narcissism.
That's different.
I
Okay,
promise it's not
so,
narcissism.
like-
I know it's not narcissism. Sorry.
so think of like Bridezilla. Okay, think about this. I'm going to a wedding to which I'm a guest of, but I'm going to wear a white floor-length gown and a veil. It's a headpiece though, because I need to be the center of attention because it's all about me. Okay, so that's narcissism. Borderline personality disorder is going to be someone who makes very irrational choices. Someone that Pete Davidson, a comedian, is a borderline personality disorder. He makes rash choices. How?
I don't know what he does, but
Like,
Oh,
Drug addict.
he's not.
Or he was.
I think he was. I think he's clean now. But like he has some strange moods and like he checks himself in and out of like psych wards.
oh,
And he knows like he's like I'm going through some stuff. So, like he attempts suicide often.
Yeah.
I don't know.
Yeah.
I'm surprised. He seemed like good.
I know, like he seems fine, but
I thought he was just like joking about this.
oh no, he's 100% serious. Okay. DID, that's a split personality. And yes, ODD. Another thing of only a semester course. Some things had to be done. But oppositional defiant disorder is, literally, they are defiant of any opposition. So any authority figure, they have a hard time with. They will do things that are the exact opposite of what they should be doing because they just don't. They do not respect authority. They do not listen to authority. I've thankfully only had like one kid with ODD. It was just a wild ride. All right. Dr. Norton puts a cat in the room with Carl and prevents Carl from avoiding or escaping. You've recognized this question. You've seen it before. What is this? Flooding. This is different. This is systematic desensitization, which is a slow process. It would have started off with like a picture of a cat, and maybe a cat stuffed animal, and then maybe it's a video of a cat, and then all of a sudden it's a cat. But this whole like you can't avoid, you can't escape. Mama, you cannot avoid, you cannot escape. Then that's a problem. What's aversion therapy? Oh, good question. This is going to be using classical conditioning to pair. Okay, so like you bite your fingernails, and I don't want you to bite your fingernails anymore, and you like really enjoy biting your fingernails. So now I'm going to try to connect something negative with that experience. So I'm gonna paint your nails with like spicy, nasty, or whatever, and that way there's like that is trying to you're pairing a negative association. We talked about this with it's not reinforcement.
Negative.
We're talking about classical conditioning, friend. Everything you're just saying is
Ooh,
operant
that's
conditioning.
I'm sorry.
Oh, scary.
Listen, 24 hours, and you're mixing those two up. Okay, so this is
I'm sorry.
because classical conditioning is involuntary. So like, they used to do this with. No, hold on. They used to do this in prison with like child molesters. They would basically show the child molesters like kid pornography, and they'd hook up their gonads to like a car battery, and basically it's like, look at these two kids, like turned it on, and because they were trying to associate a negative relationship with like child porn. It doesn't work. So
It doesn't.
it doesn't work. Just like the conversion camps for like gay kids.
Oh.
That's the same thing. Aversion therapy is conversion camps. I'm gonna beat the gay out of you, type of thing.
Can't flooding cause more PTSD? Like,
Yeah, that's a side effect. But systematic desensitization is costly. If it's a slow process, that means you have to go to the doctor more and more. But flooding is all like one and done. I mean, you could have a heart attack and die, but hey,
But
you're.
it-
But it's cheaper.
I'm not being nobody that's
Yeah.
Who's not afraid? The dead. All right, so
no, we're afraid of dying. Yeah. Just die really quick.
go to the very, very back because I did not make this very nice. I put an FRQ and then I put 3 multiple choice questions on the back. So go to the back. I'll give you a couple minutes to do those last 3 multiple choice questions before we move on to FRQs.
Okay.
Okay.
I'm so glad.
Ooh,
I'm so glad.
which one was lithium for?
Wait, are we supposed to talk?
I mean, you can, but like maybe think for 5 seconds before you like need to answer the question.
I don't trust you.
Trust versus mistrust.
She gave me 2 different answers.
Informational social influence.
Oh. So like,
I think I chose like I thought it would be more of a converter and flat earth is to global
emotionally too.
Not that you are one. So that was a misjudge on my part.
You thought I was a flat earther?
No, like I think that you would
Oh
be
my
a
gosh.
converter
Wasn't there
of
a
flat
word
earthers. Like
Oh.
you'd be able to
and
make
you
them come back to the
lesson,
light.
you're talking about the flat earthers. Isn't that Coach Vessel? That was literally Coach Vessel.
I don't know what you're talking about.
Was it Coach Vessel?
It was
Oh
Coach
What?
my god.
Coach Vessel?
Yes, and he taught work too.
That's actually.
No way.
Yes,
It doesn't work here anymore.
Yeah.
Thank
He
you.
still owns Tahoe. Or one like right up here.
Do you know where you are in space?
No, I don't.
Okay.
I'm so tired.
Magnolia, Houston, front of the school, back of the school.
Woodlands.
Okay, yeah, so it's,
No,
it's over there.
It's on like.
I'm from the
What's
We know.
You got some random road
You
there.
can like take
Yeah,
and go that way.
Yeah.
I've seen you drive it like twice.
No, no. Like,
Oh,
No,
yeah.
Like a
rings on my
Isn't
waist
that-
here. Oh, that's a joke. I don't get it.
Oh, also.
So-
I told her. I told
Christina.
you.
No, like yeah, I do. Like
What? Your stuff's right there. Your
Oh.
stuff's right there.
You need to get out.
It was here the whole time.
what happened? No.
He left it in the hallway. He's
I
right
did
there.
not. He was there.
I know.
Okay, let's go over the back, shall we? Okay.
There has to be something on this spreadsheet that describes.
Which of the following factors? Oh, I read this wrong. I don't think my key is right. Okay, which of the following factors is not, I didn't read that not before. Which of the following factors is not a therapeutically effective component of eye movement desensitization and reprocessing, which is EMDR? Does anyone remember what EMDR was about?
I remember like it's
Sure.
they
Like,
tried
isn't
they
it, like,
mimic the eye
going
movement to like don't they like do
Doesn't
something
it go
like
through
that? And,
another
like, try to mimic
process
your
or
eye
memory?
movement to,
Yeah, because like your eyes apparently, okay, they do move when you sleep and you dream, but scientists believe that the movement is like you filing away your memories to put into long term. And so you're basically like you're moving the files over. And so by replicating that in therapy, you're talking about your trauma and then you're following like a pen or something or a flashlight, and then you're like moving your eyes back and forth. So it has everything to do with reliving the traumatic memories. Sure, yes. Yes, you are moving your eyes back and forth to like file your memories of trauma into your long-term memory so you don't have to constantly be living them over and over again. And the fact that it's a placebo effect. You feel like it's going to work and therefore it does. It has nothing to do with a relaxing therapeutic environment. That is not why it works. Okay, so I read this as, I read this wrong. So it's actually C.
First one.
Okay. All right.
Oh.
I'm like, what?
They
You
shout
just said
at
the answer.
work.
Yeah, it's real not because it's a not question.
Yeah.
Okay. Diego, shut up. Which of the following is an SSRI, which is a selective serotonin reuptake inhibitor? Do we know what it is?
Prozac.
What is Prozac?
Depression.
It's
It's a real.
Okay, so serotonin, you're not making enough of it, so they're stopping the reuptake. It's inhibiting reuptake, meaning you have to absorb all that what you make. Which disorder is lack of serotonin? Okay, so a serotonin reuptake inhibitor is going to be an antidepressant. So all of these are either anti-anxiety meds, or there's actually one little antipsychotic. Which one's the antipsychotic? Thorazine. Okay, so Thorazine is for schizophrenia. So that's going to be your antipsychotic.
Wait, can you, I've never, can you, what is each one for?
What's what?
What's each one for?
Well, that's where we're doing that.
Oh.
Okay, so this is for schizophrenia. This is an antipsychotic. It's for Thorazine. I know that because it's got the little zine. All right. Oh, give me an anti-anxiety med. Which one's anti-anxiety? Xanax?
That was way too fast.
I want to say Valium.
Yes. All of these
Even
are.
the names are like.
Anti-what?
So these are anti-anxiety.
I've never heard of
Yeah, I like that one. Yeah, what's
Oh, wait,
You like the word
Xanax just sounds like
Chlorine?
Okay.
Oh, it's also
Prozac is the antidepressant, therefore it's the answer. Okay, what is an anti-anxiety med going to do? Agonist or antagonist?
one of them.
Agonist, because an antagonist blocks, an agonist mimics. So you don't make enough GABA, the thing that slows you down, so it's going to increase your GABA. So it's going to be an agonist for GABA, gamma-aminobutyric acid. While antidepressant is going to be your SSRI. Okay. All right, which of the following drugs is most likely to provide schizophrenic patients with some relief from their hallucinations and paranoia? We kind of just said that in the previous question. It's Thorazine. But what is the side effect of Thorazine? Tardive dyskinesia. Tardive dyskinesia.
Possible side effect?
Possible side effect, not necessarily a forever side effect. Speaking of schizophrenia, we're about to, never mind. We're about to do an FRQ about it. I don't want to tell you all the answers. Okay, so let's actually do the bottom one first since we're talking about schizophrenia. It says often misunderstood schizophrenia is a psychological disorder, that one, the one on the bottom. So you can do what I did, because I didn't give you much room. I just wrote down like keywords that you would definitely have to say to get the points. So keep in mind, tomorrow, oh my God, I nearly threw up. Tomorrow, can you do like causes, colon, bloop, bloop? No. The causes of schizophrenia are like full sentence. No colon. You can do A, B, C. You can do bullet points. But the bullet points have to be full, complete sentences.
It's easier.
No, you do not. You space out your
Wait,
answer.
what-
That's literally the first thing that you do.
No, I mean like for like each thing.
Okay, sure.
No, like
But like A, paragraph, or sentence or two or three.
no, yeah,
Space.
that's what I was saying.
B.
Yeah, yeah.
Sentence. Or two or three. Okay, so hey Jess. Yeah. So work on that bottom FRQ and then we'll go over some possible answers. That's fine.
Hallucinations and
Yes.
Thank you.
What'd she say?
Hallucination and illusion.
Oh, period.
Diagnosed.
It's because it's easy, but like on this one.
Yeah.
Think.
Where do I go, Jessica?
Yeah. He doesn't know where to do first.
After. I didn't lock it.
What do you mean?
Because we do you have to put like an actual research findings or like
Okay, thank you.
No, like a
Oh, I see.
trimester thing.
oh my god.
It's not genetic code.
So she.
And I don't know.
Oh.
See how it's spaced.
Oh.
Oh, then
I would
Yeah,
appreciate it.
yeah.
And because you put global.
So what are you calling research?
But if you put a space between each
I don't
one.
think
I'm
that's-
gonna do that, but I always.
Yeah, I was.
Well, you
No, no,
might
but like
get
how do you put it into words?
Yeah, but you're gonna get like 5 or 6 sheets of paper.
Oh, research.
So you're gonna have to dedicate a space.
How much time do we get for like one?
50 minutes for 2 FRQs.
Oh, that's easy. We wrote ours faster than
If
that.
parents have it, you'll get it.
In a
Sorry.
week.
Why don't you say that out
Research
loud?
is
Sorry, I thought it was
If
small.
one's parents
Okay.
have schizophrenia.
Like 3 FRQs.
It's 2 FRQs. One is always research methods, and then one is like
Schizophrenia too much.
random.
It's schizophrenia like not nothing.
Explain, explain.
I don't know if there's.
Yeah, or
So it says,
um,
What is the
Yeah, not
here
difference?
is an
What is the
experiment.
difference between hypothesis?
What was ethically wrong?
She's
That's subjective.
DD Brit.
No.
Oh,
Yeah.
yeah. Oh, yeah.
Ethically
Yeah,
wrong.
Yeah.
Debrief.
Yeah.
Oh,
DD
damn.
Brit.
Right.
Yeah, good luck.
Debrief.
It's in
I
there.
see.
Don't
You and
what's called you like
You ready? Just let
I don't
that.
really care.
She got mad at us.
I was like, don't.
I just know the
Like
color
3 parents
awareness
were
of
absent
papers.
for like school club or whatever,
No.
and they're like, "Can we like take?" It's like, no.
Can
And
you do what?
FRQs,
and
can you
right
take
to
this thing?
withdraw,
I was like,
protection,
just like,
privacy, you can't take it.
Okay.
Like, she got mad.
Can't harm too much.
Yeah, I remember we said.
Too
Hey,
late.
you remember the
12.
bit?
Right. She's so weird.
Thank you.
Dorothy.
Emotional
Dorothy.
Is that cool?
I don't get like the
Flooding
reality and all
seems
that
unethical.
crap.
You should write your like dissertation about it.
Yeah.
Actually, there's this you.
I have my whole dissertation plan is right here. You become a
Not
doctor.
independent,
Oh,
but
it's like an
okay.
inhibitor.
And so
You have to write like a
going to
paper.
her font.
It's called your dissertation.
I know
you
it was.
seem like
So when you have depression, you have
Like
to
going
like,
to the
you have
I
not
did it during the
necessarily-
star.
Yeah, not enough.
Would you
No,
recommend
you have, like,
cramming
2
or
hours.
Yeah, you have not
seconds?
enough. I'm pretty sure.
What do you think is best?
I just can't understand things about the brain. I'm not.
Because, okay, here's
Don't
my night, here's my night, right?
We both
Write an essay that Abby and I have not started that's due tonight, okay?
When did he assign
No,
you?
stop. I literally just said
Oh, I'm not
that.
blaming Mr. Taylor at all.
Not like
I
this.
fully do not blame him at all. Fully on us, 100%. Anyways, we have that, and then I have like pickup list because I begged you not to get sick, but I think that.
I get the answers.
Then I have the AP test, so it's like all in
I'm
all.
really good at making.
Should I
And then I have
leave a little bit of time up? Like, should we think of study for this?
Bio.
And it's like that's
Like
actually a
Spider-Man?
really good idea.
You should go to bed at a
Like,
reasonable
and there's, like,
time.
not the answer.
But you
That's
should be
so
working
satisfying.
until
I
then.
don't know why, but
Is it a good idea for me to go to
You know my
paintball?
gadget is probably.
Go to where?
I'll just like, hey,
Paperwork
like, notes.
tonight? Yeah.
Hey, can we talk about schizophrenia? Oh, well. Talk about schizophrenia?
Yes.
Yeah.
Yeah.
Okay. So this is an FRQ that we haven't seen in a while. So it's like, well, because it's not a bullet point, a list of random things, and it's not a research methods one. They recently updated the one FRQ must be research methods just in the last 2 or 3 years.
Oh.
So this is relatively new. So in the
That's nice
past,
because then you like know for sure. You'll
True.
probably get like
true.
one of them.
Because like if you don't know anything about schizophrenia here,
You're done.
you are like, yeah, you're done. Okay, so it says it's 1% of the population, blah blah blah, whatever. Okay, identify 2 characteristic symptoms used to diagnose schizophrenia. You can say 2 of the following: hallucinations,
Delusions.
delusions,
Yay.
flat affect,
What's that?
like they're tone of voice. It like
Oh, and
doesn't.
word salad. Right?
Word salad.
Oh, like the catatonic.
You can also say catatonic.
Yeah.
Oh, okay.
Like
So you can say
flexi, what do they call it? Waxy flexibility. Flexi waxability. No, waxy flexibility. Okay, did anyone have something on A they're not quite sure if it's right or wrong? You cannot say split personality.
all.
You cannot say that.
That's the last question.
Yeah, because they're commonly confused. Okay, B. Be careful with B. Because it says, discuss a research finding that supports genetic basis for schizophrenia. You cannot just say it's biological. It says genetic basis. So you could have said, based on twin studies or family studies, when family members have schizophrenia, other family members or twins have a higher likelihood of developing schizophrenia. So you can talk about family studies, you can talk about twin studies. I doubt you went this way, but you could have also said this, because in the prompt it says schizophrenia is a disorder affecting 1% of the population. So you could say, hey, it's 1% across all cultures, showing you that it's not environmental, it's genetic. Because it's the same throughout the entire book. It is a little bit out there, but that was in the rubric for this FRQ. All right. What is the dopamine hypothesis regarding the origins of schizophrenia? Too much dopamine.
Oh, that's right. It's funky.
Too much dopamine.
Right.
Over excess abundance of dopamine.
Are antipsychotics reducing the dopamine?
Yes, they're dopamine blockers. So
Wait,
Too much dopamine is for.
wait, if it's a blocker, wouldn't it just be increasing dopamine? Because it's.
it will be absorbed.
Wait, so what's too little?
Oh, it's preventing it.
So
Okay,
it's
I
Wait, too little
okay.
dopamine
I was
is
thinking it was a
depression.
reuptake.
No. Okay, too little dopamine is not depression. Okay, in reality, yeah, dopamine is related to a whole bunch of things, including depression. For tomorrow, for depression, it's serotonin and norepinephrine. Too little dopamine is what? You know this?
Oh no.
Oh, Parkinson's.
Parkinson's.
Wait, what?
Parkinson's
Wait,
is
wait.
too little dopamine.
Parkinson's
Too
is
much
too much.
dopamine is schizophrenia. So you need to be Goldilocks. You need to be just right. Too little.
So if you have Parkinson's, you should.
So
No, that's why they do
Too little.
Like
in-
CBD.
Right.
No, I do.
It's,
Obviously,
no,
cannabis for
like how much?
yes, it helps with the shakes and people that also have low appetite. So it helps with their appetite as well. Okay. On D. Sorry, I like switch D and E down here. On D, describe how medications used to treat schizophrenia affect the actions of neurotransmitters at the synapse. So,
I was actually.
antipsychotics block dopamine receptors, or you could say they're a dopamine antagonist. So they block dopamine receptors.
Where does serotonin come in? Or do we not have?
Depression.
Oh, right.
And anything with a sleep or eating, like your appetite.
Honestly, I'm not.
Which is why people with depression either sleep a lot or not enough, and their appetite's all over the place.
What other like disorders have too much?
No, just gonna be, I'm sure in the real life, yes. As far as we need to know for tomorrow, just schizophrenia.
Oh, Michael.
Okay, F. Just kidding. E. Identify a risk inherent in using medications in the treatment of schizophrenia. There's like so many things you could say here. Here's what you can say. Tardive dyskinesia.
I was about to say the base one.
Okay. Another answer. They don't take the meds. If they are paranoid schizophrenics, they're probably going to be paranoid and not take the meds.
Spelling doesn't count, right?
Spelling does not count.
It's hard as okay.
Also, overdose.
Right.
Yummy.
No.
I'm sorry.
I'm confused.
So you
Yes.
just overdose on me.
Thanks. Yeah.
You do enough of anything.
Well, yeah, but
I
I
Do you just have to say like
You-
you have to explain like
It has to be a full sentence. So you have to say inherent risk in using schizophrenia could be could result in tardive dyskinesia.
but you don't have to like explain what it is.
It doesn't say, it just says identify, it doesn't say explain. Identify just means like, bloop, just say the answer. Noon.
Like,
No, it's a
And?
PM test, so I know like
At 3:50.
Yeah.
They
Are you
said- Yeah,
serious?
it's like late.
They said that
They
most
said it
afternoon
wasn't-
tests are gonna be let out around 4.
oh yeah, it's crazy.
Hey,
I need to tell my job.
Yeah.
Probably not though.
Because
It
they
might
said
be a
the
lot
AP
earlier
Chem
than
is still
this.
testing right now.
Well, chem is different than
I
psych.
know, obviously.
Chemistry
like, just is.
It's
Oh.
Still
like
testing, bro.
100 multiple
And
choice.
It's
and
70,
phone?
it's 100 multiple choice questions for 70 minutes, and then FRQs are 50 minutes. So it's 100, it's 120 minutes
I
of
know.
actual
They're only
testing.
in ones.
What?
Exactly.
There
Break.
is a break.
Like
It's like
10.
5 to 10.
We're good of you to join us, friend. Okay.
Just make them sign the paper.
Okay. Oh, we can do
I
this.
signed it.
It's fine, you're all signed in. Here's what you cannot say on that answer. On the rubric, I made it very clear. You cannot say the meds don't work. Can't say that. And you cannot also say that they get used to the drugs and so they become like tolerant. You cannot say they become tolerant. But you can say overdose, they don't take it, or the easy one is tardive dyskinesia. All right. Last but not least on this FRQ. People sometimes confuse schizophrenia and DID. Identify 2 characteristics that differentiate DID from schizophrenia. Here's what I put. DID is when you have 2 or more personalities. Another one is DID is often associated with memory loss. Because if one of the personalities goes away, when it comes back, time has passed and it feels like, where was I? What's going on? Who am I? Where are these people? DID is associated with childhood trauma and is not genetic. And DID is much more rare than schizophrenia. Oh yeah. And which is really sad, I didn't write this down, but it was on the rubric, that DID is more common in women than in men.
Yeah, that makes sense.
That does make sense, you know,
Yeah,
the trauma. What's up?
So for E real quick, if you say tardive dyskinesia, like due to like some medications, like is that okay, or do you have to
Can't
specify?
say due to some medications. You have to say tardive dyskinesia is a side effect of antipsychotics.
Okay.
Yeah. Or the
Like, you don't have to-
medicine
you don't have to
used to treat.
specify the specifics.
You do not have to specify.
Okay.
Okay. So on the last one, we're gonna do the last FRQ. This one is more up to date. It's not using terms though. I mean, it is using terms, but it's using perspectives and about Jerry. So I'm gonna give you some time to work on Jerry, major depressive disorder. Notice how it says explain the cause of the depression, but also the treatment. If you just talk about cause and you don't talk about how you treat it, you get every question wrong. So make sure that you read all parts of the question and answer all parts of the question. Go. What, did you want one of these? You got one.
I'm not even sure I want one.
No, that's not an option.
Why would you
Sophia,
not?
come get one.
I have one.
Oh, see, look
How
at
do you-
that. You do have one. Look how prepared you are. Hello.
For humanistic, how would you like describe the concept? Like kindness, I don't know how to.
No, there's some key words with humanistic.
What the heck?
A triangle.
Yeah.
Some might say a hierarchy.
Oh my god.
Oh, like
Elaborate.
hierarchy of needs?
I'm confused.
You want to put that in
Oh.
the humanistic perspective?
We can mention that one. Okay.
Oh.
From the
I thought.
Oh, I see.
Oh.
Oh, I understand. I was really, really scared. I'm like looking kind of scared for this test. Like,
At least it's not.
I've realized every time I tell anyone I'm taking it, they're like, "Oh, it's free. Everyone passed that." I'm like, well, why am I so terrified then? Why am I genuinely so afraid?
I'll make at least 50 now.
That almost like ups the fear. Because when
I know.
everyone's all
It's like because if you get a 2, it's like what's wrong with you? Like,
right, everyone
passes
passes it and oh, you failed
Okay,
it.
well, 6-7% of people who take the Mandarin test get 5s, but you don't see me get 5 on a Mandarin test. Exactly.
Same as Spanish, I took it.
So for like biological, I'll be like, can I say it could be treated with SSRIs?
Yes.
That's actually really good. I put medication.
Medication would have been fine.
Okay.
I put drugs.
I'm leaving.
Don't give me a thumbs up for drugs. It's the opposite of the DARE program.
Didn't we have to sign a contract or something?
No.
We will not take alcohol or drugs ever.
I saw.
You're allowed to, alcohol with your parents.
That's not part of the DARE program. Alright,
Does Dare even talk about alcohol?
Wait,
I don't think DARE exists anymore.
We
There
got it.
did
Yeah.
exist. Someone I know, they're like 30. Someone I know
Yeah,
was
it
in
was
it, and they
like-
were awarded for like they were like a drug addict and everything, but they were chosen as the person like represented for their 5th grade, whatever. They dropped out of high school and became a drug addict and
That backfired.
got a felony.
So that award was not valid.
Here,
No,
we'll give an award.
It did not have predictive validity.
Okay, but if you think about it, like I saw some TikTok where it's like all these drug programs that like tell you like don't do these drugs, like tell you all about the drugs, tell you like where you can get the drugs, so, like don't do it. But it's like you're 13, you're not thinking about that. But then it's like because you know that information now, you will be thinking about it. Thus, when you're older and you can do it, you will.
I mean, you have to be smart enough to
No, it's
No, but like
when you inform, people are less likely, not more likely.
I don't know. But like personally, I feel like it would like backfire.
No, but whenever you said weed can cause schizophrenia, I'm never trying it.
Oh, you're pass out.
That's a good idea.
Please.
Okay. All right.
What? I'm
All
scared.
right. Go for it. It's funny. That's very funny.
But honestly,
I have to
It's the
leave.
truth, though.
that's like
Guys are really
people say like you should give your kids like alcohol drugs so that you know.
And Michigan,
Exactly.
and we're in
That seems like a very
Yeah.
permissive parent thing
I
to say.
Exactly.
Well, that's really different. Like you should just let your kids like drink at your house because it'll prevent them from doing it somewhere else.
Yeah, it's
What if they just do it?
Interesting.
Okay.
Miss Taylor, have you ever done any drugs?
I don't think she's gonna
And,
do that.
yeah.
To be honest, never drugs.
Yes.
Jacob, have you ever done any drugs?
Not really.
They're not in order here, but I'll do none of the hard stuff.
One time I tried
So I'll see like.
coke.
Yeah, we had classic.
I don't know
What is it? It's Breaking Bad?
I don't know what
it
it
is.
No.
That's that.
Hey, Chris, everything.
Wasn't that like?
We have to play our
Yeah,
part.
exactly.
Yeah.
Remember last year?
Hey, a couple more minutes before we go over.
Oh, I can't do
A couple more minutes before we go over. Jessica, Chris, work on this. Yours is empty.
We're talking about it. We're actually, we don't know what to put for treatment.
Oh, that one, I remember how I said like every FRQ has like one bullet point that's like, I don't even know what you want from me.
Yeah, it's like.
That's this. That's the trait.
So did you talk about it?
No, it's, yeah.
You could, yes. Even though you're
No,
feeling,
like, how do you get treated for?
If you listen to me,
Yeah,
that's literally what it's treated.
I don't know, I forgot.
My brain is too fried.
I just can't pull it out of myself right now.
So
You're
openness,
Seminars.
openness.
okay,
Seminars on Thursday.
Texture.
Seminars on Thursday.
I just don't know what word. Like I don't know what words to use.
Psychoanalysis.
Like I know what words to use, but I know
No,
what words
it's
to use,
explaining
but I don't
what
know.
causes, so like someone
how
who uses
to-
the psychoanalyst perspective would be like, oh, the reason you're
I don't even
depressed
know the
is
word
because
for it.
desires or things
Yeah.
that are limiting yourself and are causing you to feel this way.
Okay.
Well, I got drugs.
That's a stretch, that's a really big stretch.
some of them, you will feel stretching, you are just,
You can
So,
do it.
right?
Side eyes.
Bye.
Ryan, they're not seeing, are you a psychologist, they're saying, do you understand the words associated with this term?
Did you memorize
No.
the DSM-5?
Did you?
No.
It's Jessica, of course she did. You know?
No, I actually would have been surprised if you said yes.
It was posted just with those guys. Freshman biology comes in half.
Chris is having a moment. She needs an SSRI.
What is this?
You.
Oh, really? Would you like some
I'm gonna need some before tomorrow's test.
Thorazine? That's
That's
not.
not
That's
SSRI.
psychotic.
No, it's okay. I'm gonna open a Vicks. You don't pick alcohol because you do antipsychotics.
Yeah.
It's like a cocktail.
Isn't it like you'll die if you mix like anti-anxiety medicines and alcohol?
Like she goes from the.
Yeah.
You shouldn't.
I think they're both
I
nervous
came
system
my freshman year,
depressants,
no,
so I'm
I
pretty sure
was-
they're
I-
supposed to.
No, I did.
A kid my freshman year thought I had DID.
I think you do.
I don't know what it was.
So don't do
Okay,
it.
but
So don't do it.
No, the kid actually
Don't do
dropped
it.
out and had a kid.
Oh, wait.
Cost
wait.
you-
There are some medicines that you cannot
dropped that?
mix, because you will die.
Well, you have to
Oh,
That's
okay.
not like, that's like, you
Isn't
should
there some
not.
like you can't like drink juice with
Yeah.
certain ones?
There's like certain heart medicines that
Yeah.
you can't have any like orange juice or grape juice within
'Cause
24
the acid,
hours, or
like,
you will
shrinks it.
actually die.
Wow. What's
How do they
Who-
orange juice?
Who starts
Because
their
someone
day
drank
off?
orange
Who
juice
has
and died.
heart issues and starts their day off with Kool-Aid?
I absolutely love Kool-Aid.
Everyone.
Okay, no, that's like so bad for you.
No, I was making a joke.
Just have a glass of water or milk or
Tea.
I like water.
I religiously drink coffee. So
This
No one
is
asked
Taylor. This
you.
is Taylor.
But,
Historically, do lots of
I don't
kids
drink
fail
coffee, I
the
don't.
exam in your class?
I don't have any caffeine.
That's not even a joke. What the?
I
That was a serious.
But I still drink coffee. I'm not supposed to. Why?
No, because Mr. Taylor like tells us,
I
he'll
don't
tell
drink
us like
caffeine.
like nobody's
I'm
failed
always tired.
the final exam.
I just
Right.
drink
Like, he'll
coffee.
tell us he's talking about the star exams. No, but he'll tell us like things about his class, like
no one that takes this class should fail the STAR, because the STAR is all like, which of these words are president?
But also when he taught AP, sometimes he'll mention like his kids didn't really.
Oh, his kids did very, okay, so
So I was
I
just curious if you had that info.
But when the-
have that information.
When the Star Test talks about like Jackie Chan, like what am I supposed to do?
Okay, so for psych, I did not teach psych last year, so I'm not even gonna look at those numbers. The year before was not relevant to data, because that was the year that was like open note, and so kids took open note, open Quizlet psych tests,
Oh my god.
but then obviously bombed the AP exam because it was not open note. So the year before, okay, so that's 2020. So the year before, okay, so the last real normal year was 2019. I had 69 kids take the test, which is about what it is right now. 5 got a 1, 10 got a 2, 12 got a 3, 25 got a 4, and 17 got a 5.
Oh, that's good.
So the average was a 3.57.
Oh, that's good.
That's
That's
passing.
The average was passing, yes.
Majority of 4.
Like, but the year that was open note was like my lowest score. It was so
What?
bad. But 2.98.
What was
Why?
last year?
Last,
I know it wasn't yours.
I don't want to give that information away because it's not mine to give. And so I will tell you my eco scores, but I'm not going to tell you the psych scores from last year because it's not mine to give. What? Here it is, the average for the past 3.53, 3.38, 3.23, 3.62, 3.74, 3.58, 3.29. So
That's good.
the average kids passes.
Yeah.
Is there a correlation between people who did well on the world history of the exam and this exam?
That's a great question.
I would correct.
I don't know. I haven't sat down with Fleece and Mercer to like compare notes, but usually kids that do well in one do well in the other. But that test is so different because that test is like so much more content and not terms, it's concepts. And this is just terms. So like you could just like go hardcore on a Quizlet and do fine the next day. A world is not, an eco's not like that. So, anywho, let's talk about Jerry, shall we?
Yeah.
All right, biological perspective, causes and treatment. Causes.
Chemical
Say chemical.
imbalance in his brain.
I said
Okay, I think you could probably say chemical imbalance. I was specific and I said serotonin or norepinephrine imbalance. You could have also said hormone imbalance. You could have said genetics.
Okay.
You could have said, meaning like your parents, Jerry's parents both suffer from depression, so he's more likely genetically to suffer from depression.
Did that not talk into the hereditary?
Into what?
There was another one that was like
Your
hereditary
What's that?
perspective or something.
Oh, I definitely.
Yes, you can talk about heritability.
So that wouldn't like.
No, because it's the same thing. Heritability is biological.
Oh.
Yes.
Okay.
But okay, here's the thing. The difference is heritability is only talking about genetics, while biological could also be talking about like hormones without referring to like parents and grandparents. If that makes any sense. Treatment, drugs, SSRIs. I guess you could say, ooh, electroconvulsive therapy. You could have said ECT, electroconvulsive therapy.
That wouldn't be behavioral because it's like.
No, because it's medical. It's a medical approach.
Is the rapid the iMovie thing, is that like proven, or is that?
No,
Okay.
it's under pseudotherapy,
Okay.
so not scientific. So no, don't put it there.
Do you have to be specific with the drugs?
You can't. I mean, I can look to see if they took drug therapy. But like, if you are specific, don't be specifically wrong. Like, don't be like anti-anxiety meds. No, you have to say Prozac, and not like. You can say
Xanax.
Cymbalta. No, yeah, don't say Xanax.
See how I find it very difficult to memorize drugs and specifically what they do for each
Okay.
disorder. So you just stick to the broad. You need drugs, just go for it.
Yes.
Over the point.
Just don't
But
die.
just okay. If it's depression, say SSRI.
I don't understand.
Serotonin, the serotonin reuptake inhibitor.
No, because like some antidepressants are stimulants.
Okay. This is a high school class. High school. We know very little. Okay. Very little.
doesn't want you to actually be right. They want you to be right as to what they think is right.
Okay.
Can we
Just
draw
like
who?
no, but like just like in elementary school, it's all like, and the slaves loved. They were working in the fields, and then we realize in high school we're like, oh no, that's totally wrong. And then it's like in college, you're like, oh no, that was totally wrong. And so like the more you know, the more you realize. We came over here to get free land, and no one lived here. We shared a turkey. And it's like, no, we didn't. We killed and enslaved all of the people.
Yeah.
But you don't find that out until much later. And so it's like, what we need to know is like serotonin and norepinephrine. But of course, it's more complicated than that. And of course, the drugs work a little bit differently than what we're actually saying.
College
I wish
board has
this was a-
narcissistic personality disorder.
You wish this was a what?
Year-long course.
Yeah, well, that ship has sailed, Luke. And that's not going back. It used to be. The year that I first started teaching was the very first year that it became a semester course, because the person that taught it before had such awful scores. Like her average was a 1.2.
Ooh.
That to penalize her, they cut it to a semester. And then they were like, you know what, that's not enough. Let's just take it from her and give it to somebody else. And so I just got a semester.
Really? So what?
So
what
you
is
got
this?
punished.
It's the other one.
No, you got punished.
And
Okay.
It's not her scores.
Track her
The
down.
school that Devin came from, they did a 4 year.
Yeah, most schools do.
He's already taken this class.
Most schools do. Okay, I'll go to like AP psychology, like training programs, and there'll be like 200 people in the room, and maybe 10 of us have a semester course, and the entire room will like look around and like, how do you do it? I'm like, not well. And then they're like, oh, I can't believe, because they'll spend like 3 weeks on the brain. We spend 4 days.
Do the people with the half year course instead of the 4 year course, do they have lower scores?
Yeah, on average. Okay, great.
Monster.
All right, this one's hard. Like, hard. So you could have said many of these. Okay, you need to make sure that you are using trait terms, but you could have said many different things. Here's what I said. His personality characteristics lead to him having negative thoughts and emotions. Example, he's high on neuroticism, and his worrying makes him feel sad. Or he's low in agreeableness for Ocean, and because of his non-agreeableness, he has no friends, and that makes him feel sad. You could have said, oh my gosh, I don't know. He's an introvert. And because he's an introvert and he doesn't have many friends because he doesn't go out in social settings a lot, he is sad.
I almost put that. I thought it was stupid, so I did it.
So what if I put that for the treatment? I said.
Well, his treatment, you could have said many things. For treatment, you could have said his therapist forces him to works on his his therapist talks to him and helps him with his neuroticism, and so he's less worried about things. And he, how do you change your personality with therapy?
Great question.
You basically just have to like make stuff up. Oh, well, the other way.
Okay.
He gets therapy, so he's no longer an introvert, and he puts himself in more social settings, and that makes him happy because he has friends. Yes, you can say that.
Can you switch being an introvert to an extrovert?
What?
Can you switch being an introvert to an extrovert?
In your FRQ, you can.
Okay.
Yeah.
I thought you couldn't do that.
Okay, psychoanalytic. Hey, Ryan, we're still doing tutoring. I don't know that. Okay, so psychoanalytic perspective. Here are his the cause of his disorder. Unconscious feelings and thoughts. Subconscious desires. He is in denial of his feelings. His depression is a defense mechanism. Well, he's taking it out on himself. He's projecting, but like on himself.
Can you say like he like unconsciously like thinks he's a failure or something?
Yes. The word unconscious is going to get you the credit here. Okay, so
subconscious.
Subconscious, yes. You could say that there is a battle between his id and his super ego, and so his ego can't like take the battle, and so therefore he feels sad.
Unconscious, subconscious. We can use those.
I think subconscious is probably a better word, but unconscious is still a thing. Unconscious does not mean like lack of consciousness. Like unconscious is not a coma. But like, okay, so there's your consciousness, your pre-consciousness, and your subconsciousness, also called unconsciousness. And so like, whatever you're thinking about right now is your consciousness. Got it? Okay, but I can pull things to your consciousness that are like floating there at the top. What'd you have for breakfast this morning?
Cereal.
Okay, so you weren't previously thinking about that, but you could easily bring that to your consciousness, so it was in your pre-consciousness. Why the characteristics that you like in people? Why are they the characteristics that you like? Does this have something to do with your relationship with your parents? That right there is like, I don't even know that I'm thinking about that. Like, I don't even know if I can access those feelings. Unconscious, subconscious. Okay, so how do you treat all of these psychoanalytic things? Aha, here we go. Dream analysis. Hypnosis. Rorschach ink blot tests, also known as a projective test. What is that? You tell a story.
It's like finish the sentence. You did.
Yes, but the story one is like, here's a picture, come up with a story that goes along with it.
It's like TAT.
It's TAT, because a tat is you have a picture that you always have stories that go along with your tattoos.
What's it called when they like talk and they try to like get you to just
Free association. It doesn't have to be talking, it can be writing. But free association, talking and writing, yes. What I was saying earlier was TAT, which is thematic apperception test. Thematic, as in like a theme.
Be able to like give them the full name and ask for it?
I think they'll probably take TAT. But if you want to, like gold star. Okay. Does anyone have an answer on C for treatment that they're not sure if it's right or wrong? Because you could have said so many things here. Draw a person, sentence completion. Anyways. Okay.
And that's treatment?
That's treatment. Yeah. Behavioral. All right. Behavioral.
For the last one.
Yeah.
Could treatment be like, because didn't Freud do like dream analysis?
Yes, I said that first.
I didn't hear you.
Sorry. Yes, dream analysis. Behavioral. Okay. So you need to say something about either classical, operant conditioning, or modeling. But here's what you would say. I think the easiest one is he was reinforced in the past for being depressed. He was sad in school and got a lot of attention for being sad at school. And so now he slips into a deep, deep depression because he was reinforced for his depressive acts in the past. You could have said, modeling. He saw someone being depressed and sad and is more likely to like copy that. and it was modeled to him. You learn by observation that depression is fun.
Does that actually happen? Like, you see someone, like, your friend has depression, so now you kind of, like, slowly are conditioned into it.
I feel like that happens. It's like,
This is
Like,
a
there's
question
always
that I
a
would
friend group that's just
Okay, so
depressed.
like your moods do link up. There is mood linkages. Being around sad people will make you more sad. Being around happy people will make you more happy. So that like links up mood. So yes, it's not like, but subconsciously that is happening. Of course, you don't want to use the word subconscious in this bullet point because that goes along with psychoanalysis. But yes, it is happen. It does happen.
That's whenever I took my SAT lessons, they told me the day of my test that I was not to talk with people that kept saying that they were gonna fail.
Oh, 100%.
Yeah.
If someone is on like tomorrow is like, I am not ready for this, you know, like whatever, I'm just gonna wing it. You walk away from them.
Yeah.
We're gonna get a 5.
Because even your neurons in your brain, there are mirror neurons
No, actually.
who mimic unconsciously people's behavior. And so it's like the mood, and then it becomes a self-fulfilling prophecy. You want to be around people that are living their best lives. Okay, thank you. Hey, how do you do treatment here? Counter conditioning, very nice.
Yeah.
Okay, what is counter conditioning?
It's like I can only explain it
Yeah,
now.
every time that you are like, I'm sad, hit. I am no longer sad. Yeah, reward. You could say token economy.
Yeah, but that's
Wait,
for
isn't that-
schizophrenia, right?
Yes, but
Usable.
it's usable because that's operant conditioning, which is behavioral. And so even though it might not be real life what they do, it's a term that goes along with that perspective. You could have also said cognitive behavior therapy, because even though it says cognitive, it is still behavior therapy. Where it's like you, let's focus on the thoughts that we have. Let's reinforce our good thoughts and punish our bad thoughts. And last one, humanistic. You know who's not self-actualized? Jerry's not self-actualized. He cannot be his best version because maybe his self-esteem is bad. Or maybe he's homeless and hungry. Maybe he doesn't feel safe. And so because he is not fulfilling his lower levels of a hierarchy of needs, he can't possibly be the best version of himself. So how do you fix it?
Find a nice safe
Okay, does anyone know like the term? What'd you say?
I said not that.
Oh.
Not self-actualized.
That's correct.
Oh, okay.
Client-centered therapy or active listening is what you could have said as a correct answer here for therapy. Client-centered therapy. Remember active listening where you kind of just repeat back to them what they said so they feel heard? And remember, they're not sick, they're clients. They're not patients. They're just looking for a better. And yes, you could, age, acceptance, genuineness, and empathy. And unconditional positive regard. You could have said unconditional positive regard.
We love you no matter what.
Carl Rogers. Did you say Karl Marx?
No.
Carl Rogers. Not Karl Marx. Okay, kids.
Did you answer that?
Again?
One sentence cause?
Yes.
I don't think
Yes,
it's
I would definitely split it up. That way you know if you've finished answering the question,
I don't think
because
we
you're
love
like
it.
making a
It's okay.
conscious
They asked me
choice
when
to
I'm
like
bomb because
break
I
it up,
said that.
but also the grader knows, like, it's
I
easy
don't
to
think you guys want to be told back.
No, it would be like, I would define it, I would do like cause, treatment, space, cause, treatment, space, cause, treatment, space. Alright, kiddos, study tonight. Space out your effects, space out your studying.
Because urban epicness.
Yes, you did.
Is that thing supposed to
So,
be the
I
main
am
thing, the thing we do after the Easter eggs?
Yes. The thing. Hello, Ryan.
How surprised would you be if I got a 5?
I would be not like, oh my god. I would be like, good for him. Good for him.
What?
I would be very happy for you.
What do you expect? Personally, I think
I
I can get a
expect
4.
you to try your best.
Like, I expect a 4 from you. I would be upset with you if you got a 3. I would be pleasantly surprised if you got a 5. But I would not be surprised if you got a 4.
What about me?
You're gonna get a 5.
You should get a 5. I would be upset with you if you get anything less.
Okay.
No
Thanks,
pressure.
Mom.
Yeah, so
I've been pretty confident on all the units up until like, I feel like I'm a little iffy on 7, 8, and 9, but I still know them.
Those are
So
the
has
worst
the
ones.
okay, so here's what you're gonna do.
I'm confident, like I know the information, but I just feel like when I'm reviewing, I just feel like I know the ones from the beginning more. It's just, I guess, because like,
Primacy.
Oh,
I was
I'm
about to
so
say, yeah,
lost
first
in
and
it.
last.
Okay, so you're going to first do like crash course videos, not crash course, but it's called. Hold on, I
Driving
gotta.
into a wall.
Oh Jesus!
I missed the half the cognition unit.